For many of us, our sports days are long gone, but that doesn't mean we're no longer prone to getting hurt.
A meniscus tear can happen on the basketball court just as easily as it can happen falling off a ladder. How those tears are treated is our focus as we imagine better health.
Dr. Eric Samuelson is a CHI Health orthopedic surgeon. Good to see you, doctor.
Welcome
Thanks
back.
for having me.
And let's be honest, I mean, you could tear your meniscus by stepping off the curb, couldn't you? I mean, there's different ways to tear this. And what is the meniscus?
So you're exactly right. The meniscus is a cartilage ring between the end of the thigh bone and top of the shin bone. So it's a structure that helps protect the underlying articular cartilage.
So the red part here.
The red and all the way down to the silver inner portion.
Okay.
So this whole area right between my fingers here is the meniscus. And it really protects the cartilage from increased stress, prevents arthritis, those sorts of things. And you're exactly right. You know, sometimes it's an acute injury like sports or falling, more significant injury like falling off the ladder. But oftentimes it's just a normal activity that you wouldn't think would cause a significant injury, like you stumbled off a curb or just I had one patient just get up off the floor that sustained a bad meniscus tear and needed to be treated.
Is that age-related, or is it just something with the anatomy that happens?
Yeah, certainly it can be age-related. Younger patients, the meniscus is more robust and resilient, I guess you'd say, so it's harder to cause a significant tear. But certainly as patients get more wear and tear of the knee joint over time, occupation, those sorts of things, it can be easier to cause significant meniscus tears.
Do you know right away that something's wrong, or when patients come in, maybe they don't know that there was an issue, but they start giving you the symptoms, and then you know what's going on?
Yeah, I think it's certainly a little bit of both. There's ones that are quite obvious, patients that had an acute injury where they have a lot of swelling in the knee joint and it's causing catching and locking. Other times it's more subtle. It's just the pain started out of the blue and sort of been a nagging sort of issue that isn't causing a lot of swelling. Maybe it's very minor and not as much of the mechanical symptoms that we think about. But oftentimes it can be relatively obvious the more you delve into what their symptoms actually are.
Yeah, what are the treatment options? I imagine surgery is probably not the first option. Are there other things you can do to treat it?
Yeah, so oftentimes, particularly patients that have a little bit of arthritis, it's more of a wear and tear issue, we certainly try some conservative treatments first. So anti-inflammatory medicines, there's over-the-counter things like ibuprofen, Aleve, and Advil, but there are also some prescription ones that work a little bit better. Physical therapy and aquatic therapy is always an option that's worked well for many patients. And then oftentimes we also consider doing something like a steroid injection to alleviate pain and help patients get back to their more normal activities more quickly.
Okay, so we do all that, and then sometimes,
sometimes
surgery is
certainly
the only option, right?
You know, particularly in younger patients, sometimes they'll have the meniscus tear so bad their knee will actually be locked in position. They can't straighten or bend it very far, so that obviously doesn't work too well when you're trying to do physical therapy.
So what does surgery entail? Once you get in there and start working your magic, what are you doing?
So there's a couple of different ways, a couple of different things that we think about in particular. One is the blood supply to the meniscus. So at the periphery, the blood supply is quite robust, and you can repair those with stitches and expect it to heal relatively well. Then in the middle portion, where you see the dashed lines, that's more of the blood supply is sort of so-so, and you can try to repair them, but sometimes it's not as reliable of healing. And then the inner portion, which is sort of white or yellow here, the blood relatively avascular, doesn't have a blood supply, and we can't get that to heal back together with stitches. So for certain tears, like a radial tear, which you see towards the back here, or this parrot beak or flap tear, those are ones that we can't get to heal or scar back together, so we're really left with trimming out that torn portion of meniscus, called a partial meniscectomy, in order to eliminate the pain associated with the meniscus tear and whatever mechanical symptoms they're having.
Yeah, and I imagine whatever the procedure is, whichever option you have to go with, that will depend on how long the recovery is. I mean, is it an outpatient procedure? What's the recovery time like?
Yeah, the recovery for something like a partial meniscectomy, it's an outpatient surgery. So come into the hospital, have the procedure performed, and go home the same day. There's usually not a whole lot of rehab associated with it or a whole lot of restrictions. Whereas some tears we love to repair because, like I said, it protects the cartilage. So for ones that are more vascularized, we can fix it with various techniques to put stitches, just like you would suture a laceration on the skin and expect the meniscus tear to heal. That's also an outpatient surgery, but there's a lot more restrictions as we try to protect that repair and expect it to heal over the course of 4 to 6 weeks.
But either way, so a couple of options surgically, and then you had that whole list of treatment options that didn't involve surgery at all. Can you have a normal life? I mean, once you tear your meniscus, because we're talking about in some cases teenagers, and then maybe folks who are retired or whatever. Can you get back to normal, or is there always a lingering issue?
Yeah, I would say our goal is to get patients back to full function, 100%, and certainly younger patients that have an acute tear that we're able to fix, they're more likely to get back to
Doing the things they love?
doing the things they love, including sports and whatever activities they love to do. Certainly patients that are older that have some significant arthritis, we're able to treat the meniscus tear, but not necessarily the arthritis with this arthroscopic type surgery. And sometimes they're significantly better, 90% or 95%, but there's still a little bit of pain from that cartilage wear and tear that we're not able to treat with this type of surgery.
If you do have a knee injury, a tear, is the meniscus the one you want to tear compared to like an
What a
MCL
question.
or an ACL injury?
Well,
Pick your
certainly,
poison.
You know what? Which one do I want to tear?
so MCL injuries actually heal without surgery with bracing and some physical therapy, so that'd probably be my number one
That's
choice
number
if
one.
I had to
MCL.
pick
I
one.
have torn my MCL.
ACLs usually require surgery,
That's
so
another
that's
one.
one.
Can I
that's a little bit more
choose
robust.
D, none of the above?
There you go. That's
There you
good.
go.
So we're showing you information now about CHI Health Orthopedics between Lakeside and Emmanuel, but then the website, it's chihealth.com/ortho.
Unfortunately, we really don't get to choose, do we?
No, unfortunately
Life
not.
doesn't work that way.
It doesn't work that
As long
way.
as you have
Doctor.
options.
Yeah,
Thank
good
you
to
for
see
coming
Thanks
in.
for coming
Thank
Good
you
to
for having
see
me.
you.
There's a lot going on.